Hello, myself Dr. Samiksha today. I am a homeopathic psychiatrist and the counselor. Today we're going to learn about the treatment approach of the post-traumatic stress disorder. In the previous video, we see about कि क्या sign and symptoms है PTSD के. Before going to the treatment part, the most important part is the diagnostic. So what are the different diagnostic criteria where people diagnose you as a PTSD? So your doctor or your therapist may perform a physical examination to check for a medical problem, which can cause the symptoms. It can do a psychological evaluation, which can include a discussion about your sign and the symptoms or the events. And we generally use for the diagnosis of particular mental disorder as the DSM-5. So it's a diagnostic and statistic manual of the mental health disorder, through which we generally diagnose a patient of any particular condition like PTSD. So the treatment is very important in PTSD condition. Q, because it help you to regain a sense of control your therapy, control your life. So the primary treatment is the psychotherapy along with the medication. So क्यों psychotherapy लेना important है? With a therapy or with a treatment part, it help you to develop a stress management skills, which can help you to better handle the stressful situation and cope up with the stress in your life. Like अगर कोई इवेंट हुआ है आपके साथ, कोई ट्रॉमेटिक इवेंट हुआ है जिसकी वजह से यू मे डायग्नोस्ड एज अ PTSD. So by taking a treatment, by taking the help of a psychotherapy or by taking a medications, it help you कि वो stressful situation से कैसे निकलना है first of all, and second is अगर in future अगर stressful situation आ रही है तो उसके साथ कैसे डील करना है. बिकॉज ऐसे तो हो नहीं सकता है कि आगे लाइफ में स्ट्रेसफुल सिचुएशन नहीं आने वाली, वो आने ही वाली है. सो उसके साथ कैसे डील करना है, दैट यू ऑल्सो लर्न इन अ ट्रीटमेंट पार्ट. सो यू कैन help it also help you to think better about yourself, others, and the world. The learning way to cope if the symptoms arise again, and it also help you to treating the other problems along with the PTSD like depression, anxiety, alcohol abuse, or the drugs. And all this approach with the medications, with the psychotherapy, it only help you to gain a control of your lasting fear after the traumatic event. So what are the different psychotherapy? We'll see that. So there are the different psychotherapy. Your therapist or your doctor may do that. The first is the exposure therapy. So the exposure therapy, it's one of the behavioral therapy which help you safely face both the situation and the memory that you may find frightening, and you can learn to cope up with them effectively. So this therapist or the doctor create a safe environment in which a person or the patient it expose of the things जिससे आप डरते हो या जिसको आप अवॉइड करते हो. कोई भी एक्टिविटी हो सकती है, कोई सिचुएशन हो सकती है, and this therapy helps you to reduce your fear, to reduce your flashbacks, to reduce your nightmare, decrease your avoidance. The second therapy is the eye movement desensitization and the reprocessing, EMDR. So in EMDR, it is the combine of the exposure therapy. It's with a series of the guided eye movement. It helps you to process the traumatic memory and it changes how you react to them. So in this therapy, there involves the movement of your eye with a specific way while you're processing the traumatic event. And it helps you to heal from your trauma or other distressing life events. Another therapy is the cognitive therapy. This type of the therapy help you to recognize the way of your thinking, that is a cognition pattern, and that are keeping you stuck. So cognition मतलब your intellect. जो भी आप सोचते हो, that can turn into your emotions and that can turn into behavior. For example, अगर thought में अगर मुझे कुत्तों से डर लगता है या डॉग से डर लगता है, So by seeing dog only, I get that emotions डर वाला, and my behavior is automatic learning to भागना है भागना है भागना है. मे बी वो जो डॉग है वो बहुत ज्यादा स्वीट है, वो काटता भी नहीं है, बट माई पास्ट मेमोरीज कि डॉग ने मुझे काटा था. सो दैट थॉट्स कम इन टू माइंड कि नहीं भाग नहीं, डेंजर है वहां पे. सो अल्टीमेटली थॉट्स इज कि डर लग रहा है एंड बिहेवियर इज भागना है. सो द दीज आर द साइकिल्स. सो जब आप जो भी सोचते हो, अगर निगेटिव सोचते हो आपके इमोशंस निगेटिव ही रहेंगे एंड आपके अल्टीमेटली बिहेवियर में भी निगेटिव आएगा. सो ये सोचने का जो तरीका है वो आपके थेरेपिस्ट चेंज करने की कोशिश करेंगे बाय टीचिंग यू सर्टेन टेक्निक्स, एंड इट ऑल्सो हेल्प यू इन PTSD condition. So along with psychotherapy, the medication is very important. So the homeopathic treatment help you to remove the imprint of the trauma and brings about the natural recovery. Because homeopathic remedies are made up of natural substances and it's very safe. The person does not make it personal dependent. So there are the certain medicines I'm going to tell you, but without consulting any doctors, please do not self-medicate it. Because I know it's very safe medicines, but it is also harmful. It may not act upon you. So please do not prescribe yourself. So aconite are maybe prescribed in cases of the panic or the terror, restlessness. May patient feel the palpitations or the sensation of prickling or the tingling. The ignitia remedy is helpful in a situation of the grief or the emotional shock. Phosphoric acid, it helpful in the following a trauma. The person become withdraw and had difficulty in concentration. So they don't want to think or communicate the avoidance symptoms. The patient has in depression with a silent grief. Staphylos aureus, it is useful remedy for those who has been abused or bullied or humiliated, but do not express their anger. They may be resentful and the depressed, and this is one of the main remedy for the physical symptoms that appear after the suppressed anger. So these are the certain medicines. There are many medicines. Obviously, the homeopathic medicines are acted different for a different persons. So if two persons having a PTSD, I may prescribe the certain medicines to the one patient and another medicines to the other persons, because everyone is a different, everyone having a different characteristic. So the medicines also differ from person to person. So with the psychotherapy, with the medicines, the coping and the support is also important. The first important thing is follow your treatment plan, because for to recover the PTSD, it will take a time. It's not like that if you start a treatment and you will feel better after 1 month or the 2 months. It may happen, you may feel better with a 1 month or 2 months, but you need to focus or you need to follow your treatment plan for a longer period of the time. Remind yourself that it take a time. Following your treatment plan and routinely communicate with your doctor, with your therapist will help you to move you forward. Another is the awareness about the PTSD, because the knowledge can help you to understand what you are feeling and it can develop the coping strategy to help you respond effectively. But that doesn't mean that you only search on the internet, because by searching internet or Googling your symptoms, it can only lead the anxiety. So better talk with a doctor, talk with a psychiatrist, talk with a psychologist, or talk with your therapist and ask them a question and get aware about the PTSD symptoms. Third, most important, take care of yourself. Get enough rest, eat healthy diet, exercise, take time to relax. Try to reduce the caffeine or try to reduce or try to stop actually the alcohol, nicotine substance. Sleep well, learn something new, म्यूजिक सुनो, खुद की केयर बहुत ज्यादा लो. As I earlier said, don't self-medicate it because it will harm you. Stay connected, spend time with the supporting and the caring person, like maybe your family, your parents, your friends, any faith leader, or talk about what happened if you don't want to. Just sharing time with your loved ones can often healing and comfort. As I said, avoidance is not an treatment plan. Talking about it with a particular person or with an understandable person, you may find a solution. So stay connected. And if you feel that you having a certain traumatic event or you are not able to concentrate or you're not able to cope up with it, don't forget to take a help. Thank you. So trauma creates a change you don't choose, but you can choose a healing.